The critical care unit is a unique environment. Our patients are seriously ill and have complex needs. Therefore, it's important that we have the right evidence to support their care.
Right, Julie, what have we got here?
This young lady is a 16-year-old called Karen. She was admitted yesterday with an eating disorder, quite poorly overnight.
So how did she present?
She was admitted with severe anorexia nervosa. She was found collapsed by a mum at home. Was found to have a blood sugar of 1.3. A BMI is 10. She has had anorexia for the previous 2 years and has been treated at Clatterbridge Hospital for that. She's not been admitted to Arrowe before.
This is the first time she's in critical care?
Yes, first time in critical care. She's got no further medical history or surgical history. She lives with her mum and dad at home. She has got no allergies, and currently her airway is patent. She's respiratory is breathing spontaneously.
And the blood pressure is reasonably stable now?
Her blood pressure is low at the moment.
Right.
She's had some gelfusion for that, which hasn't made a massive improvement.
Okay. We started refeeding her yet? No, we haven't started. So we don't have a plan in action. Do we have any protocols for this, Julie?
I haven't got any protocols in their folders.
Right. Because we've got to sort of start feeding very slowly and sort of build her up. We've got to go as per her body weight and sort of increase it. I think it's 10 or 20% per day, but I'm not too sure about that. So we also have to worry about, as you said, refeeding syndrome. We've got to worry about the phosphates, but we've got to do it in a planned way. So we don't have any guidelines. No. Victoria, this is something for you.
Yeah.
So anorexia nervosa in a critical care setting, refeeding, and the prevention of refeeding syndrome. Right.
So if I have a look for any guidelines or protocols nationally on anorexia nervosa and a feeding regime to prevent refeeding syndrome.
Yep.
Okay, that's fine.
Right.
I'll have a look.
Considering her weight, that's probably just about enough.
It's been really useful having Victoria on the ward rounds for many reasons, the most important one being for the patient care. She finds us the most relevant and up-to-date information, and we then are able to treat our patients appropriately. It's also really useful from a time point of view. As nurses, we don't always have the time to go and do these literature searches, so Victoria will do them for us, and that's really useful. It's also cost implications. We want to make sure that we're giving our patients the most cost-effective treatments, and by Victoria finding out these things for us, then we ensure our patients are getting the best care. And she's also very useful for us as nurses and the multidisciplinary team. She goes and helps us with our master's courses and any of the courses any of the staff are doing.
The presence of the clinical librarian on the ward round has created a evidence-based culture and fosters an environment in which we learn about the best ways and the current ways of treating patients. The information she's given has also allowed me to incorporate it into guidelines which we now regularly use on the critical care. They're available both on the intranet and also as a paper-based resource. That's actually helped for the pharmacy department as well as the critical care department.
I attend the ward round alongside the ITU team and listen to the discussions taking place at the bedside. With this being a critical care environment, there's a lot of patients admitted who are seriously ill, so decisions relating to their care need to be made extremely quickly. There are often times on the ward round where the discussion would benefit from access to the best evidence, whether that's guidelines, evidence summaries, research articles or individual case studies. Unfortunately, doctors and clinicians in the team don't have the luxury of time of searching for evidence themselves, so having a librarian on the ward round ensures that that search for evidence is a much quicker and a much more accurate process. I can search key health databases such as Medline and Embase, and also key health websites for the latest guidelines, protocols, evidence summaries and other research studies. Some searches cover topics that the team use just to check that they're treating that patient in accordance with the best evidence, so they use it as a check for their evidence-based treatment. Other search questions relate to conditions or treatments that are less commonly seen in a critical care environment, and in that situation the evidence provided can have a significant impact on the knowledge of the critical care team. At the beginning of the project, we conducted a 10-month pilot which evaluated the impact of the evidence-supported ward round, and the pilot actually demonstrated that without the presence of the clinical librarian, the gaps in knowledge would not have been pursued. It also demonstrated that the evidence summaries that were provided contributed significantly to an understanding of the treatment, the condition, and improved patient management.
Right, so Victoria, what have you got?
Okay, so the latest national guidelines are the Marzipan guidelines, which are the management of really sick patients with anorexia nervosa. They're Royal College of Physicians guidelines from 2010. So
Have you seen these before?
No.
Right, has anyone seen them? No.
There's also an evidence summary here on managing medical complications in anorexia nervosa in adolescents and adults, and that's got some additional
I just saw a flowchart in those Marzipan guidelines, a flowchart.
Yeah.
See, that's a flowchart of what you do on a daily basis in critical care, and that's probably what we need to plan her management on. So if you can sort of sit down with Debbie and the dietitian as well, and sort of get a daily management plan according to this flowchart, and then we can sort it out from there. Is that all right?
Yeah,
All right. Anything else?
No.
Is that all right, Victoria?
Yes.
You've got that?
Yeah.
Okay. Right. Should we see the next patient? I think the take-home message here is that we get the right information because Victoria's on the ward round. We get the right information at the right time in the right place. That's the right information. That's evidence-based information. At the right time, that's during the ward round, and in the right place, that's at the patient's bedside. So as a result of this, I think that having Victoria on the ward round has had a very positive impact on my clinical practice.